This Saturday, a virtual event is taking place to help those struggling to have children. Two doctors will be bringing their expertise on infertility to the discussion. Dr. Caitlin Dunne is a reproductive endocrinologist and co-director of the Pacific Center for Reproductive Medicine. Dr. Alda Ngo is a doctor of Chinese medicine and acupuncture. Welcome to both of you.
Thank you for having us. Thank you.
Dr. Dunne, I'll start with you. How prevalent is infertility in couples that are trying to start families?
Infertility affects 1 in 6 or 15% of reproductive age couples. And it is something that we don't talk about very often, probably because of the stigma and the shame surrounding it. So I'm grateful that you're having us on the program today to raise awareness.
Are those numbers fairly consistent, or do they change over time?
We have found that the demand for fertility services, things like fertility consultation or IUI or IVF in vitro, those services are becoming increasingly in demand. And there are a number of factors driving that. One of them is that women are choosing to have children later in life because they may be pursuing education or their career and they have ready access to contraception. But we're also seeing more diverse families, like our LGBTQ community having families, and single women by choice choosing to become mothers. So there are a number of factors driving that trend.
Right. Dr. Ngo, as a doctor of Chinese medicine and acupuncture, you're going to be speaking on infertility stress in your presentation. Let's talk a little bit about that. What role does stress play in terms of infertility and when you're trying to have a child?
Well, stress is definitely a huge part of the experience for fertility patients. There's actually research that shows that the psychological symptoms of anxiety, stress, and depression in fertility patients are similar to those associated with serious illnesses like cancer and HIV. So I've actually had my own fertility journey. I struggled with primary infertility for several years and suffered 2 miscarriages. So I can actually really attest to this, as I think, the other 1 in 6 Canadians can as well. I know that for me, it led to feelings of shame and inadequacy and self-doubt and depression and anxiety. And it was something that really trickled into every aspect of my life. So into, work and family and into my social life. And it felt very private and taboo to talk about. And, I was very sad and it was very isolating. So, people who have to deal with infertility are usually pretty derailed by this, because the common narrative that we learn in school is that it's really easy to get pregnant, right? And so psychologists actually recognize that this kind of disruption to the reproductive story, which often involves miscarriage and loss, it's a form of trauma.
Right. Well, so, it's beyond just the physical, right? There's certainly physical things that have to happen, obviously, but there's emotional and the stress. And was it acupuncture for you that helped you come through?
Yeah, acupuncture and mindfulness was a huge support to me. And, any kind of just, when we're undergoing something like this, I really needed the medical treatment. I really needed the Western medical treatment. But I also found that just having more options, and having an integrative approach really offered me support in terms of a whole person.
Right.
So I felt that when, the Western medical procedures were paired with holistic and stress-reducing approaches as well, it helped to restore my sense of control and agency.
Dr. Dunne, in this virtual event, you're going to be talking about common myths when it comes to fertility. What are some of them? What are some of the misconceptions out there?
Well, one of the biggest myths is that infertility is all the woman's fault. That's absolutely not true. In fact, about 30% of the time, infertility is the sperm's fault, and about 50% of the time, there's at least some component of a male factor. So that's part, again, of reducing that taboo and that shame associated with infertility and putting that all on the women and saying, we need to take an approach to looking at both sides. And then the other myth that I want to talk about is that it's easy to get pregnant, right? We often think that there's a 100% chance every month to get pregnant, but even a healthy couple in their 20s has about a maximum 20 to 25% chance of getting pregnant every month. So when I see couples in my practice, I try to reassure them that this is a journey and it's very normal that this can take some time.
So in terms of treatments that are available, Dr. Dunne, what kind of hope can you offer couples when it comes to options? What's available to them?
Well, this is not a one-size-fits-all journey by any means. It's really important that if you're struggling with infertility, to see your doctor and to have a complete workup. A lot of the time, infertility troubles can be fixed with optimization of hormones, some counseling around the best time to detect your ovulation, and there are some basic tests that we can do in that process. If you do need help from reproductive technology, then it ranges from everything including tablets or medications to insemination, which is a sperm washing procedure, all the way to in vitro fertilization, which involves injections and making embryos in the incubator.
And Dr. Ngo, you've mentioned obviously mindfulness, acupuncture, some more holistic type approaches. What else is in that realm? What other hope or tips could you give for a couple that's struggling with infertility?
Yeah, so, much like Dr. Dunne was speaking to, it's not always a one-size-fits-all approach either. We support, people in conceiving naturally, or we play a supportive role for people who are undergoing assisted reproductive treatments like IVF. So for example, patients undergoing assisted reproductive treatments at PCRM will often pair their treatments with a treatment plan from Whole Family Health, which includes evidence-based natural lifestyle modifications, mindfulness, acupuncture, nutrition, massage. We look at ways to help to detoxify, to increase blood flow, to decrease inflammation and stress hormones. And, we really look at ultimately optimizing overall well-being to optimize reproductive health. And so at Whole Family Health, we really see that this integrated care ultimately offers more options for support that decreases stress.
So just final question for both of you, and Dr. Dunne, if you want to go first, but just advice for a couple that maybe is stressing, maybe they're feeling like they don't have support. What advice would you give?
Well, you're not alone. I say that a lot. Infertility, unfortunately, is common. It is a medical disease that is absolutely worthy of investigation and treatment. And there are many people in Canada that are struggling with infertility, but fortunately, there is help. So the first step is to see your doctor and get some of those tests started. And you don't have to do that all on your own, right? Once you become sort of part of the process and you're sort of in the fold at PCRM, and we really want you to feel supported so that we're helping the medical side of things, but also the psychological side of things.
Dr. Ngo, final thought from you.
Yeah, so, very much, I echo what Dr. Dunne says. You're not alone. And, really seek out those resources, and seek out community. We are putting on this free event, at Whole Family Health. We understand that infertility can be stressful and isolating. We want to offer this, special free event in partnership with PCRM to help to destigmatize infertility and to normalize the conversation around infertility. We want to acknowledge the 1 in 6 Canadians who are struggling with infertility and let you know that you're not alone. And we want to offer you, this empowering information and tools to help you. We want to, we're going to, again, speak to infertility treatments, the common myths. We're going to offer you some natural and accessible lifestyle wellness tips to support overall health and reproductive health. Information on detoxing the home, mindful breathing exercises, nutritional tips, home acupressure and massage stretches, and just, ultimately, you don't need to go through this on your own. And don't be afraid to ask for help and to advocate for yourself, and to reach out.
Really appreciate you both joining us to discuss this today. Thanks so much.
It's my pleasure, Rod.
Dr. Caitlin Dunne is a reproductive endocrinologist and co-director of the Pacific Center for Reproductive Medicine. Dr. Alda Ngo is a doctor of Chinese medicine and acupuncture. Both are going to be part of a free virtual event this Saturday. To register, just head to wholefamilyhealth.ca. Again, wholefamilyhealth.ca.